of Ireland joins a handful of countries temporarily suspending the rollout of the Oxford AstraZeneca vaccine. We'll find out why some nations have concerns about the jab.
We'll hear from the people transforming their own old telephone boxes into libraries and art galleries to brighten up their communities.
And it's almost a year since we first went into lockdown. Here on Breakfast, we've been looking back at photos before everything changed, and we want you to send yours in as well. You can send them through via email, bbcbreakfast@bbc.co.uk.
So the Republic of Ireland and the Netherlands are the latest countries to temporarily suspend the use of the Oxford AstraZeneca vaccine.
It's after a small number of people in Norway reported experiencing blood clotting after receiving the jab. However, the World Health Organization says there's no evidence of a link between the two. Let's discuss this and a couple of other issues with our GP this morning, Dr. Nigat Arif. Good morning to you. Lovely to have you on the programme again. Happy Monday and all that. Let's talk about these safety concerns around the vaccine then. What sort of things should we be thinking about this morning?
So these are absolutely legitimate concerns, and I understand that lots of patients have been looking at this. And I've had patients approach me as well, saying I'm worried that there could be some clot risks. Unfortunately, with the vaccine programme, we are dogged by a lot of myths and misinformation, and that's spreading widely on social media. I've been on here, Dan, many times discussing about vaccine hesitancy amongst Black and Asian and ethnic minority communities. And as we are going down in the younger groups, obviously these concerns are getting far more. So we've had the chips, we've had, is it linked to pregnancy, which it isn't. This is an experimental technique, vaccine, that we're using, which it isn't. This has gone through all the rigorous trials. And now the new evidence that's come forward is that it's linked to clots. So let me just clarify this for the public about clots. So I, as a GP, have been working as a GP for 14 years. I see DVTs, clots, PEs a lot. Unfortunately, our background risk of having a clot in the population in the UK is a 1 in 100 people, 1 in 1,000 people will have a risk of clots. If you get a flight, your risk of clot increases. Women who are on the oral contraceptive pill, combined oral contraceptive pill, their risk of clot increases. People who go in for hospital for surgery. However, we don't stop doing any of those things. We don't stop putting women on the combined oral contraceptive. We don't stop getting a flight because of the risk of clots. And this is exactly what we should be doing with the approach with the AstraZeneca vaccine. We shouldn't be stopping the vaccination program, and we definitely should be just looking at the data. It's great that we have systems in place. So the MRHA has a yellow card system in place. That means if a patient has a reaction or a side effect, then we are actively monitoring that. And also, this is part of pharmacovigilance. We are being safe and trying to keep a tab on the numbers. Of the 24 million doses that have been given in the UK, about 17 million doses of AstraZeneca have been given in Europe. Actually, there's only been a handful of cases, 15 cases of clots. And yes, they're concerning. And yes, we're going to be looking into them. But that doesn't mean that we should be worried or concerned at the moment. We are still looking at the data and finding out the risks of benefits, because of the risks of not having a vaccine is actually far more detrimental.
And when you're having your conversations with patients, obviously, you're giving us an idea of the sorts of things you are saying there. Are you able to allay most of the fears about I suppose it goes back to some of the rigorous testing that happened around the vaccine in the first place?
Yeah, of course. It's having that open conversation with your patients, looking at the patient individually, discussing the risks versus benefit. We know that in order to get out of lockdown, one of the roadmaps of getting out of the lockdown is to make sure that we have a herd immunity and everybody's vaccinated. So it's trying to look at then the patient's own risks as well. What else? What other medications are there that they're on? Have they had clots before? And it's trying to counsel those patients. I've been vaccinating since January with the Oxford AstraZeneca vaccine in our local community hub, and we've had no cases of clots at all. Yes, we've had the sore arm, the headaches, the aches and pains, a few temperatures, but that's the case with lots of vaccines. This is something that we just need to keep just looking at and reassuring, and then look at a patient individually when we counsel them for the vaccine.
And also, I'd love to catch up with you on this Monday morning to find out just generally how things are going in terms of the vaccine at your surgery. Is progress still happening at a good pace?
Do you know what? Actually, the vaccine's going really well. I'm so happy because we're actually, I find doing the vaccine clinic the most positive thing that I do in the week, because people are just grateful to be there. Patients who've been shielding for months on end, loneliness, mental health has been going through the roof. And so they are finding that actually they do understand the reason why we need it. And there is this air of positivity. Like, my cup is getting bigger. I do feel I need to have a bigger cup, Dan, because there are far more stresses that are going to come through my way soon. And the concern about lockdown locks, I've got a solution for that already. So
are you Louise is already booked in with her hairdresser. Have you got an appointment sorted, Nigat?
Well, actually, because I cover my hair, Dan, I'm not that concerned at the minute. My concern is trying to make sure I get through my surgery and see my patients. But I definitely, underneath all this, do need to get my locks cut at some point. But the point is that patients are so positive. People are really looking forward to coming out of this lockdown and making sure that we are all trying to keep the transmission rate, the hospital numbers down. And remember, we know how to deal with viruses. It's always still washing your hands, covering your face, making sure you're keeping that social distancing. And I'm seeing that students going back to school, they're still social distancing. So I think now, fingers crossed, we shouldn't be going into a fourth lockdown.
OK, well, we do keep our fingers firmly crossed. I'm afraid that's the only size mug we do, by the way, Nigat. That's it. Oh. We don't have an extra large mug. So you just have to do 2 if you want extra 2. All right. See you later. Have a lovely week.
Oh, good to see her as ever. Sally's here to talk about